Hi, my name is Matthew Hammond. I'm a fourth-year graduate student at the University of Connecticut Health Center, and I'm actually in the neuroscience graduate program, but I study the immune response following hemorrhagic stroke. So I'm here and a member of AAI because I'm interested in understanding the innate immunological mechanisms that cause secondary damage after sterile injury, and also mechanisms of repair and recovery. At AAI this year, I am interested in networking and meeting people from all over the country with similar interests in immunology. Last night we had a networking session party celebrating one of our former mentors who unfortunately passed away, Leo Lefrancois. And I was able to network with PIs from around the country, and I met a professor at the University of Georgia where I did my undergraduate studies. So that was interesting and productive. So over the past several years, I've been trying to influence the field of immunology, and we recently published a paper showing that inflammatory monocytes that are positive for the chemokine receptor CCR2 worsen outcomes in our mouse model of intracerebral hemorrhage. Similarly, we saw that independently of other known predictors of poor outcome, elevations in CCL2, the chemokine for monocyte recruitment, are correlated with poor outcome in patients. And so now I'm trying to understand how later outcomes in the mouse model and in patients can be improved by potentially modulating the cells toward more of a pro-recovery phenotype rather than the pro-inflammatory phenotype that we see them early on after hemorrhage. I'm interested in learning about new mechanisms of monocyte and neutrophil mediated damage that I can take back to my lab and see if they're applicable in our model of intracerebral hemorrhage. In the future, I'd like to be a leader of a neuroimmunology laboratory in industry because I'm interested in developing therapies for devastating neurological diseases.